Hello everyone. I'm grateful for the opportunity to present on such a critical topic that affects millions globally, addiction rehabilitation and recovery. Today, we will explore the multifaceted process of rehabilitation from understanding addiction's root causes to examining effective recovery strategies. We will cover the neuroscience of addiction, the stages of rehabilitation, psychological approaches, holistic methods, real life recovery stories, and the importance of community in long term sobriety. Understanding addiction. Addiction isn't just about substance use. It's a brain disorder. When individuals use substances, they release dopamine, a neurotransmitter linked to pleasure and reward. Over time, the brain's reward system becomes hijacked, leading to dependency. Let's consider Robert Downey Jr., who publicly shared his struggles with substance abuse. His career was nearly ruined and his personal life suffered immensely, demonstrating the far reaching consequences of addiction. Understanding the brain's involvement helps us comprehend why addiction isn't simply a matter of willpower, but a complex interplay of biology and behavior. Before discussing the rehabilitation process, what can a parent or teachers do to help a child avoid drug abuse? Every parent wants their child to grow up safe, healthy, and confident. One of the biggest challenges we face today is protecting children from drug abuse, and prevention begins at home. First, communicate openly with your child. Have honest conversations and, more importantly, be a patient listener. Children are more likely to share when they feel heard. Show genuine interest in their hobbies, activities, and friendships. Knowing who they spend time with helps you stay aware of potential influences. Encourage them to talk about their problems before they become too big. Teach them that life's challenges can be managed without turning to drugs. Set the example yourself. Children learn more from what they see than what they hear. If we expect them to avoid drugs, we need to avoid smoking, drinking, or misusing medications ourselves. Keep an eye on prescribed medicines at home. Use them only as directed by a doctor and safely dispose of leftovers so they aren't misused. Remember, children may know more about drugs than we realize. That's why it's important for us to learn the facts too, so we can guide them with accurate knowledge. Prevention starts with connection, example, and knowledge. When we listen, lead by example, and stay informed, we give our children the strength to choose a healthy path. What should you do if you feel that someone close to you is having a drug problem? When you suspect your child might have a problem with drugs, your first reaction matters. Fear, panic, or anger can close doors, but calm understanding can open them. First, be certain there really is a problem before confronting your child. Assumptions can damage trust. If you do confirm a concern, don't panic or argue heatedly. Reacting with anger or fear will only worsen the situation. Instead, take time to talk it over calmly, choose the right moment, and keep your tone respectful. Show genuine interest and involvement in their life. This support can make a real difference and help them open up. Approach with calmness and care. A gentle, honest conversation can build trust and become the first step toward recovery. That don'ts. Talking harshly, being sarcastic, indulging in self pity, blaming themselves, arguing while the person is under the influence of substance, giving fake promises. The do's. When a child or loved one struggles with drugs, the way we respond can either push them further away or open the door to change. What they need most is not blame, but understanding. Start by showing understanding, not condemnation. Let them know, I see you're struggling and I want to help, but supportive and hopeful about their ability to recover. Hope can be powerful motivation. Trust them with dignity and respect. When we accept them as people of worth, they are more likely to believe in themselves. Avoid negative labels like addict or useless. Labels can damage self esteem and make recovery harder. Above all, practice patience. If they refuse help the first time, don't give up. Often it takes time before someone is ready to ask for and accept support. Compassion, patience, and dignity are not just values, they are healing tools. By offering these, we give our children and loved ones the courage to step toward recovery. How we can protect our children? Children don't just learn from what we say. They learn from how we live, how we listen, and how we guide them through life's challenges. Begin with yourself. Evaluate your own use of tobacco, alcohol, and drugs. Children notice our habits more than our words. Teach healthy coping skills. Show your child how to deal with stress and frustration in positive ways, like talking it out, going for a walk, or practicing relaxation techniques. Make time for each child. Show them they are valued by giving it attention and care. Know your child's strengths. Their peer group strongly influences their choices. Let your children know they can come to you about anything without fear of harsh judgment or lectures. Open trust builds open communication. Set clear expectations for behavior. Boundaries help children feel safe and guided. Teach your child to be assertive when appropriate, to say no to pressure and to stand up for what is right. When we model healthy habits, teach coping skills, and create an atmosphere of trust, we empower children to make strong, positive choices even when life gets difficult. The rehabilitation process. Rehabilitation is a multi-step process that involves not just getting clean, but also understanding and addressing the psychological roots of addiction. Take Demi Lovato as an example. She went through detoxification and therapy, which helped her understand the triggers of her addiction and develop healthier coping strategies. She now uses her platform to advocate for others facing similar challenges. Aftercare is often overlooked but is vital in preventing relapse. It provides individuals with continuous support and resources, ensuring they don't feel alone in their recovery journey. Role of psychology in recovery. Psychological therapy is central to the recovery process. CBT helps patients challenge irrational thoughts and replace them with healthier ones. This has been shown to reduce relapse rates by empowering individuals to think differently about their addiction. One example is Russell Brand, who used therapy as a major tool in his recovery. His openness about his journey highlights the power of therapy in overcoming addiction. Through CBT, he was able to understand his underlying triggers and take charge of his recovery. His journey can illustrate the impact of therapy and group sessions in building emotional resilience. Demi Lovato, Dancing with Devil 2021, a documentary that delves into her struggles with substance use and how therapy played a critical role in her recovery. Lovato's recovery showcases the importance of psychological support in healing trauma. We also have motivational interviewing, which helps patients find their own reasons for recovery, making it more sustainable. It's a client-centered, directive approach that encourages patients to overcome ambivalence. Holistic and alternative approaches. While traditional therapy is effective, many individuals find that mindfulness practices like yoga and meditation help them reconnect with themselves and promote healing. For instance, Giselle Bündchen, a prominent model, openly talks about how mindfulness and meditation helped her manage stress and maintain balance, both in her career and in overcoming personal challenges. Gabor Mate, in the realm of Hungry Ghost 2008, highlights the role of trauma in addiction and advocates for holistic healing approaches like mindfulness. Mate's insights of addressing root causes of addiction through non-traditional methods. Michael Phelps CNN held interviews and worked through the Michael Phelps Foundation. Focuses on integrating mental health, exercise, and mindfulness in addiction recovery. Phelps' journey exemplifies how mindfulness and physical health practices contribute to holistic recovery. Integrating these practices into recovery provides individuals with tools to manage anxiety, depression, and cravings. It's an essential part of a holistic recovery approach. Real-life success stories. Success stories provide hope. Matthew Perry struggled with addiction for years while on the hit show Friends, but after multiple rehab stints, he was able to regain his health and use his platform to share his journey helping others. Similarly, Britney Spears, despite facing immense public scrutiny, made her recovery journey public. Today, she continues to inspire others by advocating for mental health and addiction awareness. Robert Downey Jr., Vanity Fair Profile 2014, chronicles his journey from severe addiction to recovery, emphasizing the role of consistent effort and professional support. Downey Jr.'s transformation can inspire attendees with a story of perseverance and success. Britney Spears, The Women in Me 2023, discusses her time in rehab and the challenges she overcame to rebuild her life, a candid account of recovery struggles showcasing resilience and hope. These stories show that recovery is possible no matter how difficult the path. They also remind us that recovery is not linear, it's a process of highs and lows. The role of family and community. Addiction often isolates individuals, but support systems, whether family, friends, or community, are vital for recovery. One example is Michael Phelps, the most decorated Olympian in history, who publicly shared how his family and support system were instrumental in his recovery. His openness about his struggles and his subsequent advocacy for mental health shows the power of community. Ben Affleck, Good Morning America interview 2020, discusses how his family and community supported him during his recovery. Affleck's story underscores the importance of loved ones in sustaining long-term recovery. Drew Barrymore, The Drew Barrymore Show 2023 reflects on her family's role in helping her achieve and maintain sobriety. Her journey highlights how family support can strengthen recovery efforts. Programs like AA or NA provide a space for individuals to share experiences, hold each other accountable, and receive emotional support, creating a strong sense of belonging. Challenges in recovery. Recovery is a multidimensional process often hindered by various challenges. These barriers may be physical, emotional, social, or environmental. Physical challenges. Withdrawal symptoms such as intense cravings or pain can make early recovery daunting. Football player Darren Waller struggled with withdrawal during his early recovery from opioid addiction, requiring specialized medical care. Emotional and psychological struggles. Anxiety, guilt, or depression can surface as individuals confront past actions or traumas. Actor Ben Affleck, recovering from alcohol addiction, openly discussed the emotional toll of addressing his issues, emphasizing the importance of therapy. Mac Miller, articles from Rolling Stone and GQ, discuss the challenges he faced with relapse and the ongoing struggle of maintaining recovery. Miller's journey highlights the difficulty of relapse triggers and the continuous battle in recovery. Carrie Fisher, Wishful Drinking 2008. Fisher candidly discusses the emotional and social challenges of recovery and coping with stigma. Her experience illustrates the mental and societal hurdle that often accompany recovery. Relapse triggers. Environmental factors or high-stress situations often lead to relapses. Celebrities like Robert Downey Jr. have shared how being around certain social circles hindered their recovery initially. Stigma and judgment. Many fear societal judgment, leading to delays in seeking help. Prince Harry highlighted the stigma surrounding therapy and substance use, advocating for open discussions on mental health. Innovative tools and strategies are making addiction recovery more accessible and effective. These methods integrate technology, science, and community to enhance success rates. Digital interventions. Apps and telehealth services provide constant support. For example, Recovery Path offers virtual counseling connecting users to a support network. Programs like this were crucial during the COVID-19 pandemic, ensuring continued access to help. Virtual reality therapy. VR simulations prepare individuals for high-risk situations. VR tools developed by researchers in the US help recovering alcoholics navigate party settings virtually, teaching coping mechanisms. Medication-assisted treatment. Integrating medications with therapy addresses both physical and psychological aspects of addiction. Buprenorphine has been life-changing for many individuals struggling with opioid addiction, reducing cravings significantly. Community innovations. Recovery cafes and fitness focus groups offer inclusive support spaces. The Phoenix combines physical fitness with group support, making recovery a shared journey. Matthew Perry, Friends, Lovers, and the Big Terrible Thing 2022 highlights how modern therapies and structured recovery programs helped him. Perry's experience underscores the benefits of innovative personalized recovery approaches. Russell Brand, TEDx Talk 2018 advocates for progressive recovery methods, blending therapy, community support, and holistic strategies. Brand's innovative perspective on recovery can inspire fresh approaches to the treatment. Strategies for long-term sobriety. Recovery doesn't end after detox or therapy. Long-term sobriety involves continued personal growth, setting healthy boundaries, and learning how to cope with life stresses without turning to substances. Regular therapy, attending support groups, and engaging in healthy habits like exercise and mindfulness can prevent relapse. We see this in the case of Eminem, who, after years of addiction, sought ongoing therapy and support to maintain his sobriety and continue his career. His story is a testament to the fact that sustained recovery requires consistent effort and commitment. In conclusion, addiction rehabilitation and recovery are complex but achievable. With the right support, both individuals and communities can overcome addiction. Let's continue advocating for those affected by addiction and ensure that recovery is seen as a journey, not as a destination. Call to action. For healthcare providers, embrace holistic and innovative recovery techniques. For families and communities, create supportive and judgment free environments. For policymakers, invest in research and accessible recovery programs. Recovery is possible for everyone with the right support and strategies. Individuals can reclaim their lives and thrive. Thank you.